Hey everyone, welcome back to the Med Boys podcast. Dr. Brendan Gallagher is an oral surgery resident at the New York University. He's an entrepreneur, public speaker, podcast host, and so much more. We're honored to have him in the podcast, and I'm sure it's going to be a great conversation. Hi, Brendan, how are you doing?
Doing great, doing great. Thank you guys so much for having me on. Been a busy day and I love podcasting. Love to connect with you guys. I'm super excited right now.
Thank you so much for coming on. We can't even imagine how busy you are right now. And to take this time out, it really means a lot. To get started, we wanted to ask you a little bit about your journey to getting to this point. Like, what did you do? Could you tell our viewers a little bit more so they get some background?
Oh, absolutely, absolutely. Okay, so oral and maxilla, and it's different. I think it's the same in Canada, but in the United States, oral and maxillofacial surgery residencies, there are two types. You have the 4-year program and the 6-year program. The 6-year program has an extra 2 years because you spend those 2 years in medical school and you get your MD. The 4-year track, which is what I'm in, I don't get my MD, but I get in and out. It's quicker. And the fact is, probably around 99% of oral surgeons, for the surgery that you do, the job role that you go into, you don't actually apply. In MD, you get a phenomenal amount of knowledge, right? An unbelievable. But for oral surgery, you don't necessarily use it, right? And I wanted to weigh out those pros and cons, and I thought I want to get to work. I want to get to it. You know what I mean? That being said, so the route of getting into a residency in oral and maxillofacial surgery in the U.S., you go similar to going the medical route, right? You got to go 4 years of undergraduate. You got to get the prerequisites to take the MCAT in medicine. You take the DAT in dental. From there, you go to a 4-year dental school, similarly to a 4-year medical school here. And then from there, you apply directly into oral surgery. Now, one of the things is that if you don't get in right away, you can do a residency year in general dentistry. You can do a residency in what's called a non categorical oral surgery resident. So that's a 1 year intern year at an oral surgery residency somewhere in the country. And then you reapply during that year. You get experience in surgery. You get it shows that you're really willing and committed. Say you had a weak application, some students would say that it gives you another 1 or 2 tries to take the CBSE, which is kind of like the MCAT and DAT for medical and dental school. The CBSE is the dental school exam you take just for oral surgery itself. Um, Gives you an extra try or two if you were to take an on-CAT year. I beg to differ. Personally, when I mentor students, I say don't take a non-CAT year if the CBSE is your weak point because you're so worked in residency as an intern in a non-CAT year. You want to study for that. I recommend taking a GPR, general dental residency year, so you actually have time to study for it and then reapply. But that's more than you asked. I know.
Well, I mean, from what you've discussed, it sounds like oral surgery and dental school in general, it seems like a really competitive stream, and we know from what we've looked at in terms of the statistics that it's one of the hardest programs to get into in the US and in Canada. So, our next question to you is what are some of the things that you did in dental school or throughout your undergraduate career that you feel has helped you get to this point in your life?
Oh yeah. Lots of things, and it is very competitive. NYU here is extremely competitive because just a few years ago they made medical school free for students, and then the applications, it just flooded the system with that because it became like the first one in the United States that's free. Um, but I mean, not for me though, because again, I don't get that. But to get there, it's I'm going to say it too. It's cliche. You got to get good grades. You got to have a good ranking in your class. My thing is, you don't need to be one in the class, and you don't need to get the top GPA in the class. My number one thing that's different from what my mentors told me and other people is that I think you always want to get the best GPA you can get, the best ranking you can get, without changing your personality. I mean, you guys know, in undergraduate, in medical school, right? It's extremely competitive. It's extremely competitive. And I don't like to see when personalities, character, people's relating and connection with other people becomes compromised in order to they think in their head they're getting the edge. I'm gonna get more questions right on that exam. I don't think in the long run it doesn't actually pan out. And I always think personality and character comes first. Get the best ranking GPA you can. Aim for the best you can. And you know what? If you stick with a good attitude, I think you're going to get there anyway. Moving on. You need to get, like I mentioned before, a good CBSE score. The CBSE, I don't know if you guys are aware, it's like step one, but it's instead of step one questions, it's only 200, and you get a certain amount of time. It is geared more for dental, but medical students can take it too. Need to get a good CBSE ranking, GPA. You need good letters of recommendation. So you need to be spending time with doctors in the dental school to get there. You need to have done externships. Externships are when you schedule a 1 week. It's different for medical students. You have clerkships, your I forget the sub I's, right? An externship is fixed to a 1 week time, rather than when you're a sub I, you spend like a month or 2 weeks, and they divide it up 2 weeks and 2 weeks. Externship is you spend 1 week at an oral surgery residency, and basically you're shadowing around, even doing procedures, assisting in surgery, perhaps. Very important because programs are going to look at how many externships you did and where you went. So it's good to plan those at prestigious programs. Last but not least, you could say research helps in some situations. No one, I did research in dental school. No one asked me about that. I, but I did put on my application. I had 15 interviews. I put that I play the violin, research among everything else. One or two programs asked me about research. Literally 10 or 11 asked me about playing the violin. And that's good for your guys' application to med school. It is. They want to see something about your personality. They want to see how you're unique. What's going to stand out for you on your application. So that's getting into oral surgery residency. To quickly go over getting into dental school, I mean, same thing. Good GPA. You want to show that you're active in extracurriculars, leadership positions. They want to show that you're taking initiative. Sports help to show that you have experience in a team atmosphere. But as far as getting to med school and dental school, I think predominantly it's going to reside in your GPA, what school you came from, letters of recommendation, you don't usually get ranked in that, but then your MCAT and your DAT.
This is phenomenal advice for pre-med students, pre-dental students, and even dental students. But moving on to your residency currently, what do you do as an oral surgery resident at the moment?
At the moment, in oral surgery, at the moment, placing a lot of implants, extracting teeth, bone grafting. When I'm on call, lots of laceration repairs of the face, head and neck region, mostly of just the facial structures, facial fractures, bones of the face, fractures all the way up to the skull, jaw to the skull, even back toward almost to the ear at some point because the TMJ is back there. Also on call, a lot of abscess drainages. Unfortunately, sometimes splinting teeth. That's a general dentistry role, but we do it on call here at this program. That's on call. Among other things, I'm sure I'm missing a few. In the clinic, like I said, implants, wisdom teeth extractions, that's a primary oral surgery procedure. Wisdom teeth, sedations in clinic. I said implants, bone grafting, assisted on an apicoectomy yesterday, which is it's like a tooth infection at the apex. You kind of remove it, you plug up the root of the tooth from the back end, bone graft, seal it up. Cool procedure. Endodontists usually do that. And am I missing anything? Oh, we go to the OR to repair facial fractures, cancer of the head and neck here at this program. Some programs don't do cancer. Here we do glossectomies if you have cancer of the tongue, just to give you more idea. So a wide range, a broad scope of procedures. We're a very broad scope program.
Mhm. And that's very interesting. I didn't expect that. I thought it'd be more based on more relating to the oral side of things, but you do a lot of ENT work as well, from what it seems like. I can't even imagine how much anatomy you have to know. It's crazy. because the face is just something else.
You do, and it's important that you say that. So where that it's kind of derived from, as far as what I've seen. We cover facial trauma on call at the hospital, and facial trauma is rotated, at least here, 3 days. So one day it's plastic surgery that covers facial trauma. So they get any facial lacerations, any fractures to the face, trauma. The next day, it no, no, I'm sorry. First day is ENT, and well, I mean, depending on how you look, ENT, oral surgery, and plastic surgery. We rotate in the 3 day cycle on facial trauma days. But yes, we have to know. We all have to know the anatomy of the face. It's also very important to know your scope and say, like, we're really getting into the sinuses here. This is going to be better for ENT to
Mhm,
consult, right? It's very important to know your areas, especially in the tri-state area here. There, all the specialties under the sun
mhm,
are at some of these hospitals. So let's make sure the best well trained people for certain things in anatomy, like you mentioned, go to the right specialties.
mhm. And generally, how many hours are you working every week, and how much time are you on call for?
So legally, over a 4 week, like the law, legally over a 4 week period, you're not allowed to average more than 80 hours of work a week. Right now, I'm right around there, 80. I would say last year as an intern, we go over that sometimes, not to go too far in the details, sometimes way over that. But last year I was working 6 days a week. You get one full week on, and you guys are gonna have this too. In residency, you get one full weekend off a month. The other weekends, you get one day off. And that day, you might be coming out of call at 9 a.m. So you're really only getting from like 9, 10 a.m. until you have to go in at like 6, 7 a.m. the next day. So just to keep in mind, it's a very rigorous schedule.
Yeah, honestly, from what you've said and from the experiences you may have had in your internship, it seems as though there is a problem with in terms of like how sustainable is it in terms of working this hard. And why do you think that is? Why do you think that there's this cap, but sometimes residents or interns might actually transcend this cap in some way?
I would say understaffing. I think a lot of the programs, a lot of the hospitals are in fact understaffed. I really do. I really think that why do we have an on-call resident working 24 hours in a row? Why it's 2023. We determined that this is an ineffective, inefficient, and can put patients in harm decades ago. Why are we still doing that? I think it's and this is just my own I don't think, and it's different in Canada too. I don't know to what extent because I don't have the experience there, but I really do think there's a certain level of reinvestment into residency programs and such that's not giving the attention that it probably should, right? And we all like to talk about it and stuff, and I have to tweak my social media content to an extent. Not that I did anything wrong necessarily, but institutions want a certain narrative spoken about, and I've had a conversation with the office here and stuff, and so rather than getting too far into that, I'm going to leave it at that. Yeah, I think more attention needs to be put on it. But look, politics runs the show in certain things, and healthcare there's a certain financial deficit in healthcare, and as we know, insurance controls a lot of the financial scope. I don't know how it is in Canada, but so this is the reality of residencies here. There was a study. There was a study done. There were several. It was like 7 or 8 plastic surgery residents. I don't know what hospital this was. There was a study done. They took away these like 8 plastic surgery residents at the hospital. They said we're going to end the residency program here. We still have the work that needs to get done, but we're going to hire nursing, other staffing, PAs to take care of it. They needed to hire. I think it was like 22. It was I could be off by 5 or so, right? Doesn't matter. They needed to hire like 22, 23 nurses, PAs, managers, etc., to fill the deficit of those 8 plastic surgery residents, and it came out to it was something like 10. It was like I could be off. It was like $10 million or something. the amount of work that these residents are being put through. All I'm and they're being underpaid. They're very being underpaid. If you were to do it, I last year I was at like 7.48 an hour. So yeah, yeah, I could go on it more, but that's maybe for another time.
I mean,
That's
that
completely fine, and I think that when it comes to, like, the family doctor shortage here in Canada as well, it's a big problem. So we can see that it's universal, and it's difficult to address it, but no, man, you can continue with the next question.
Yeah,
yeah,
well, real quick, you guys know about ChatGPT, right?
right, yeah.
Yeah.
What, as far as family medicine goes, what direction do you three guys think we're going in as far as AI can be used in the medical spaces?
We were actually talking about this today. Like, for example, creating posts and stuff are now going to be taken over by Microsoft is designing a new AI to just create graphic designing posts, and we were thinking we don't need to make them anymore. And we've had this conversation about just diagnosing cases as well. I think we actually made a TikTok about it, about diagnosing a patient through Chat GPT. Honestly, we can't tell how accurate it's going to be. All the information comes from Google, but at the end of the day, it's just what they're getting from the internet. So it's very uncertain if we can even trust an AI to diagnose a patient. I think the human touch is still required at the end of the day. But what do you
Absolutely.
guys think?
Me or you,
Everyone.
Michelle?
I think that, like, when it comes to AI, I think one of the biggest problems is, like what Naman said, the human touch. I think that a lot of people underestimate the importance of there being like a physical person in front of you, talking to you, wanting to get to know you, and from the perspective of even like a dentist or an oral surgeon or even a physician, right? And I feel like that emotional component of caring for someone is what also helps patients sort of adhere to the treatment guidelines or whatever they're being prescribed. And I think the AI is not currently at the level at which we can really generate that emotional connection. Although there's some like research that shows that some patients do prefer the AI style of therapy because of some of the more human-based phrases they can mention. But again, that face-to-face interaction is what truly differentiates the interactions that normal people have with AIs.
Oh
Mhm.
yeah, oh yeah.
I'll play the other side a little bit. I feel like if ChatGPT is this good already, we don't know how good it's going to be in like 3 or 4 years. Like ChatGPT 4 is already coming out, which can use images and videos. So that completely changes everything. But I feel like doctors, dentists, people in healthcare, I think w- we shouldn't really fight this. We should really be using this to make things a lot easier. Because for radiology, for example, radiologists aren't going anywhere, but this makes their job like 100 times easier because if ChatGPT can solve these many things, they could probably figure out how to look at images and find things and then have someone supervise that. So I feel like integration will be the main thing in healthcare, but as we all know, like healthcare doesn't evolve that fast. So it will be kind of hard.
I completely agree with that. That's my kind of take. In medicine, it's tough. In medicine, it's tough because, well, you have the conversation with the patient, the heart to heart. You also have the surgery, and obviously, we are way too far out. I mean, decades out as far as AI taking over a surgeon's role, right? So the touch is one thing, but then the verbal, the relation, the connection with a patient, we're getting there. I still think we're a ways off. I agree with that. But here's the thing. I think so recently, last couple months, when ChatGPT came out, came a big thing. It's getting banned at schools and everywhere. I think we got to update the system. I mean, look, it's not 1920 anymore, where we're putting chalk up on the board, right? Why are we having students write 10-page papers when we barely finish reading a page? We should be teaching students how to make an effective educational video in under 30 seconds. Right, like let's move on, guys. We got like written's good. Let's work on it. Let's shorten things. And then here's another thing: we should be using AI to ask like we. Here's the thing: they were able to AI's crushing MCAT scores, step one scores, everything. But the creativity, I think, is still isn't there. So we should be teaching students how to, rather than how to, they could plug in an essay written in the form of some famous poet in 1968 regarding this topic or that topic. No, we should be teaching students how to ask the appropriate questions, and then using the product to create. It's we got to use the creativity. So to relate that to doctors, I completely agree. I think it should be an adjunct. It's not an either or thing. Let's keep the doctors. Let's train them how to use chat. Put them through medical school. Teach them how to use something like ChatGPT so that we have all the diagnoses on the board. We have all the treatment plans on the board. And then together as a team, you have the resident, you have the chief, the attending. Let's come up with the best answer, the best course. But like you said, we're way far behind, and medicine always is far behind, as well as educational systems. So we'll see where it goes.
I think like a lot of people are against it, but I think like Nimit said, we need to take a more positive approach to this. Instead of people thinking that they might lose jobs, I think it will also have the opportunity to create more jobs and for us to advance in terms of technology and AI. Um, but yeah, let's talk about New York. You it's one of the most diverse and interesting places. We've been there a couple of times, and Toronto is the New York of Canada. So, what is the most interesting case? Without obviously getting into confidential details, what is the most interesting case that you've come across in your residency?
Oof. Really cool thing. So most interesting thing in residency, the most interesting procedure I did was a bicoronal flap. That was at VCU though, where they cut from top of the ear, bicoronal over the from ear to ear over the top. They flapped this down. The guy was a cocaine abuser, had a posterior palatal defect, had no nasal septum anymore from drug abuse. And what they did was they used a portion of the temporalis muscle. They flipped it over, put it under the zygomatic arch underneath there, put a little hole in the back of his maxilla, and then used that to patch up the top of his maxilla. That was by far the coolest procedure. It was a 12-hour thing. It was blood was everywhere, tracking out into the hallway with footsteps. Here, one of the cool. Well, I mean, that's here. One of the coolest things I've done was last year, time, a little over a year ago, a little less than a year ago. There was a patient that I had to see in the ED, and he had a laceration through his actually it was through his temporalis muscle, and as you guys know, the temporal artery is over there, and I think it wasn't the temporal artery, it was a branch of it. But I took all the bandages off, I opened it up because I had to stitch it up, and there was an artery shooting backwards on me, and so I quickly covered it up. I was like, all right, they're gonna need to we're gonna need to get some sutures here, and we're gonna. I somehow like I spotted this thing when I was shooting. I got lucky. First stitch right through it, this little bleeder. First stitch got it, closed it off, and I could immediately begin the whole last repair. This is in the ED. It was like 3:30 in the morning. Um, luckily, and it all worked out great and everything. His scalp was open, and I was like, open, close. When he was opening and closing, you could see the muscle when you open it up. It was like I mean, it's a bad demonstration, but you're literally it looked like like the muscles, but in robot form. Like you could see it opening and closing his jaw as he was doing. It was pretty wild.
Mhm. That sounds exhilarating, and I've never seen something like that, obviously. But I was shadowing interventional radiology the other day, and it was like a vascular procedure, and I just was in there normally, but then a few hours later, I looked down, and then I just saw squirts of blood on on my scrubs, and I was like, "Where did this come from?" And then it was probably when they pierced the femoral artery to go in, and that was the first time I really saw blood like that. But it was really cool. A lot of these things are so cool. And what you said with all the facial stuff, we did some anatomy for that, and I've seen how many things there are. There's like nerves, veins, arteries. It's so hard to differentiate everything, whether it's fascia, whether it's a nerve. It just gets so difficult. So I don't know how you do all this. Must be insane. Yeah. So we're just going to move into some questions that are related to things other than oral surgery and dentistry. We wanted to ask you a little bit about entrepreneurship because you have some experience there. So, as we all know, dentistry and oral surgery themselves are highly busy careers, and you talked about your hours. What got you into these other ventures, getting into podcasting and companies and all these other things?
Um, a passion of mine has always been, I mean, what got me here was mentoring. A big passion of mine is mentoring, giving back, in a variety of methods. I find it really exciting to connect with other people, virtually. I mean, guys, like, let's be honest. I wouldn't have been able to meet you for at least for years until we happen to be at a conference together. But we have Zoom. We can connect. Let's exchange ideas. I'm hoping we could connect at least another point two with Dose of Dental. On a night we could get the whole team. Let's do a mixture of medical, dental stuff. But a couple things I would say entrepreneurship. I always, how they say like either work too hard, like what was it? You want to work harder or work smarter. And I always thought, well, I want to work hard, but I want to work smart too. And I was always very passionate in surgery, but then at the same time, I was like, I need to figure out methods of side revenues, right? And then, as you guys know, it's pretty nice, when you can have a side revenue going on. Um, and so it all started with featuring other dental students on Students of Dentistry in very early on, my first year of dental school. So we started with Students of Dentistry. We added on, we created top dental practices. That's over 100K now. That's doing well. Elite dentists, that's in the 50s, I think. Regardless, though, I also went even laterally, started top wineries, top breweries, top cafes, and just for fun. Let's see where we could go with it. And it all stems from the fact that entrepreneurship is about like it's a business, right? But I prefer the business where you apply value first and do it really well, and then money comes your way later. And I guess that's built on the back of branding. That's where podcasting, content creation comes in. I know I'm all over the place and throwing a lot at you, but I guess that's kind of where a lot of the passion of it comes from. The hours, look, I mean, if you want to do things, you want at work, you'll find, and you guys know this in class, there's one right answer on these multiple choice quizzes and tests and stuff, right? There's only one right answer, and you got to pick that one. There's not a lot of creativity to it. I don't know. Some in medical schools, there's short answers and stuff, sure, but regardless, the teacher wants one right answer, and it's pretty cookie cutter things. What about creativity? That's what kind of drives our personalities, right? And so when I finally get home, not every day is amazing. Not every day goes 100%. And a lot of times, especially when you're an intern and low resident, they're tough, they're difficult. Dental school's rough. Sometimes we would have like 10 exams a week sometimes, five at three, 4 or 5 in a day. Um, a lot of my escapism is getting back to the creativity that really defines me. If I had more time, I would do music production. I don't, so I went all in on entrepreneurism. And in residency, the hours are like 5, 6, 7 until 5, 6, 7. I'm still getting call. I'm not on call tonight. I'm still getting calls, and I'm probably going to be working until 9:30. And then now I'll finally get to my little thing. Until maybe 10 p.m., 11 p.m., or maybe not. I'll save it for tomorrow. But we're here on the podcast, right? I don't know. And you guys will notice it. Things get hard, and you'll see undergrad medical school residency, it gets tough, but you're going to have to find your methods to escape and work on your own projects and really what drives you, and what connects you with your friends and family that you don't get to see as often as you'd like. I could go on, but yeah, I hope that answers the question.
Of course, and I think there's a lot to unpack with what you said. And the first thing I'm going to start with is this really nice statement that you said, in which you invest in the quality of your business and worry about the money later. In fact, that's really been our motto with MedBoys, the podcast. We've put in a lot of work in our YouTube channel, and we only recently got monetized. And if we were honest, all we've made is like $40 from all the videos we've created, and we don't care. Honestly, we're really happy with the quality and the work we're putting in, as opposed to the money, because I feel like money is an afterthought. It'll come after, as long as you put in the work at the start. But I think that when it comes to so many involvements and so many activities, I feel like a lot of university students struggle to find the time to balance their academic commitments with what they want to do in life, what they want to pursue in terms of their creativity, like you said. So, what do you think are some strategies that university students can use to really balance their time and manage all the many different ventures they want to go into?
Absolutely, absolutely. We're trying to. There we go. There we go. Get a little lighter on here. Yes, number one thing. First of all, you might not. Most people don't like to hear this. Undergrad, sometimes you feel like you have less time than high school. Would you agree or disagree?
I'd agree. I'd agree.
Sometimes you feel like in college, right? You have less time than you did in high school. Unfortunately, medical school, you're going to have, at least the medical students I know, even less time in medical school than in college. And I can guarantee you, 1,000%, the amount of time you have in residency compared to medical school, it's really tough. It's really tough. So that's like the what, right? Let me get into the how to that answer. So, how do you maximize your time? I would focus as much as you possibly can in undergrad. Self awareness. I don't know if you guys follow Gary Vee or whatnot. And that's why I love that you guys aren't worrying about monetizing things. In fact, not monetizing things, draw in like a net more viewers, followers, giving value. Something will come across your plate eventually if you're doing everything you like, and monetization will come later down the road. But getting back to that self awareness, I would recommend finding the best way that you can retain information quickly and assuredly. Like, really, my thing was flashcards. I use Quizlet with the figures on it. I had the premium version. I could get through 3 sets and I'm getting 90 plus on an exam, right? Figures, because we're all very visually oriented. So what I figured out is rather than me writing things down like I did in undergrad 5, 6 times, we're talking weeks worth. It takes a week to rewrite everything at once, right? You could put it all in Quizlet once, get through it in 3 hours, do it again. You can do the amount of studying in a weekend that you would have done in 2 weeks. So it's finding how you study best, most effectively and efficiently, quickly, right? Now, why does this relate to finding time? By doing that, you can really budget down. Okay, I have 3 finals next week. I got one Tuesday, one Thursday, and one Friday. Now you know how much time you need to study for those and a little more to excel in the class, right? But then you know how much time to budget on your time. Spend with friends, family, expanding on your project, playing the saxophone, working out at the gym, having a club meeting to close out the semester. Does that make sense? I think it all comes down to prioritization, which is around your GPA, applications, the MCAT. Get that down to studying effectively and efficiently in an amount of time. And now you know what margin you have for free time, your personal life, the club, the weightlifting, the instrument. Does that make sense? Is that
Yeah, yeah, it definitely does. We actually use this app called Anki, which is pretty much the same thing like you mentioned. We've been using it since second year, and I think it's been very helpful for us. We really just combine the lectures down to flashcards and review them, and that saves a lot of time. I think that's why we're able to make time for stuff like Med Boys and outside of school. But I wanted to ask you, since we were talking about creating non-monetizing content, you were able to grow a following of over 10,000. I think it's about close to 17,000 now on Instagram. How were you able to do that? What was your approach to gaining followers?
literally one video? So here's the thing. Literally one video gained me over. I was at 7,000
Mm.
back in December, guys. I was at 7,000. I posted a video on TikTok in early January from TikTok. So, and I'll get into the method behind this. I took one of my top videos from TikTok and I put it on Instagram because I knew it did well on TikTok. Oh, let's see what the Instagram community thinks, because they're different communities, believe it or not. And Instagram videos don't usually do as well on TikTok, but TikTok videos that do well, for whatever reason, sometimes do very well on Instagram. So it's not congruent, but this one, it literally gained me 10,000 followers. And I have the statistics. Like I screenshot it because I went from 7 to 17. And it wasn't like So if you look at an account that is paid, where Instagram will say like boost this post for more reach or likes or follows or whatever. If you think about it, if you were to do that, it would have growth of, if you have a graph over time, it would spike after you make a payment to Instagram, right? You see what you find? Because you're going to get more reach instantly. It's going to give you more exposure to the things, the likes, followers from that. But then once that payment that you made goes up, boom, gone, down to zero again, right? The graph that I had from this one follower, it got over 500,000 views. It got like 20 something likes. It was this one post. I didn't have to pay anything. I knew it did well from the activity on TikTok, and it was just steady growth. I gained up to, it was over 800 followers in one day at one point, and it went for over a month and a half like this. It went up to 800, and then it's steady. It went dropped, and then it stayed up again. So that's it. That's organic reach. That's organic content, activity, engagement, right? That's what you want to go for. And we could go into strategy for that as well if you'd like at that point. And I could completely give you all ideas for your podcast. But that's what you want to do. And I think one way to go about that is make content, but geared towards different platforms. And you've probably heard this before. Make content geared for Instagram Reels. Make content geared for TikTok. Make content geared for YouTube Shorts, and also right now make content geared towards Facebook Reels. Okay, these are the four platforms I would recommend going into, especially for you guys. Okay, look what works, right? And then also make things for Instagram and TikTok, and then put them on YouTube and on Facebook. Put them on TikTok, YouTube, and Facebook. Does that make sense?
Yeah,
You might
definitely.
find that the things that work on Facebook work even better on TikTok or work even better on Instagram. And then you may find the thing that you thought was working on Instagram doesn't work at all there, and it crushes on TikTok and Facebook, for example.
Mhm. Yeah, no, we can relate to that on so many levels because what we've done is we split up. So there's three of us, so we all have different responsibilities. So I handle the TikTok, Naman handles the Instagram, and then we've seen that we put in the same effort, and then on Instagram nothing happens, and then on TikTok because the algorithm is as such, it just keeps blowing up. And then I think one of the TikToks we posted got around 150,000 views on TikTok, but then got 500,000 views on Instagram, which was just crazy. Um,
Bingo.
exactly, and then you just keep posting it, but it's also so unpredictable. So, have you found a way to kind of make this success more constant? And what are some of the strategies that you would use for that?
Unfortunately, yes, I found a way to make TikTok more effective. I had just started posting TikToks that were effective on Instagram it was like November, December. January hit mid-January. That's when I had the conversation with the program thing. I posted a video that they wanted me to talk a little less about what residency's like in patient care, unfortunately, although that's the reality of life, right? Shouldn't we be promoting this profession and exposing it for exactly what it is? It's hard work, right? It's, you're a doctor. Like, it's not easy. And we are human beings, despite the narrative that some people like to think, right? We're all human beings here. Um, so I've been at I, not at a halt, right? It's not like I'm not allowed to make content, but the content that was working the direction I was going, talking about residency and such, I had to come back. I couldn't post it all for about a month. I'm slowly working it back. I'd have to reverse engineer my content ideas in production, but like it's gonna be it's gonna take a while. So okay, so going back, I initially started TikTok my fourth year of dental school, right? My content sucked. Oh my god, it was terrible. Like 4 views and stuff. But hey, you live and learn. I did that for about a year and a half. I started residency doing that, but I was posting the same video on both TikTok and Instagram, which, as you know, ineffective. You got to separate it. Um, and then when I just started doing it, I was like, you know what? I'm spending way too much time on this. Let me just have a conversation with the camera. Since TikTok was kind of like my guinea pig, just throw some content out there. I tried 5 posts a day. I did. different things. Just try different things, and whatever works on TikTok, as you guys found out, then put it on other things. I would recommend doing the same thing for Instagram. Just do something organic. I was literally just, you know what? I'm going to walk out today. I'm going to talk about what I just did. Turns out it was like 1 o'clock in the morning. I just got out. There was a facial fracture. I evaluated. We are going to admit and do surgery hopefully the next day. That was it. 12 seconds, thing blew up. And I was like, okay, I think maybe I found something here. Turns out it was easier. I didn't have to plan these things out. I just leave for the day. I talk about what happened, what I did. And that was that. Um, it did I get enough insight, like how I would recommend kind of I would recommend all three of you guys, what you're already doing, you're on different things. Do you guys switch platforms though? Why not?
Well, the one thing we were scared of is on TikTok, when you switch the accounts, they often, like, we've just heard that they sometimes shadow ban you.
Yeah,
So that was the only problem
What do you
for
mean
us.
switch the accounts?
I
As
think,
in, like, which device it's on.
so pretty much the more people that have the account, the less reliable like TikTok will think you are. I think TikTok shadow bans people who have the same account on multiple devices. And I think we kind of experienced that because we used to have a TikTok account in the beginning, and all three of us had that account, and our views just tanked. So we
Interesting.
kind of stopped doing that, and now it's just on one device. And whenever we have to record, we just record and send it to Nimit, or whenever someone's recording for Instagram, they just send it to me.
Okay, so you can still do it though.
Mhm.
Yeah,
Yeah.
Just so you have one person sign on per account. Yeah.
Mhm.
And then did you notice like one person really does well on TikTok or Instagram?
yeah,
Honestly, like what I think from the patterns that we've seen, it's more related to like the content really, not the person that says it. Cause like there have been TikToks where like none of us have been in them and they've done well, or like one of us have been in them, they've done well. Like there's really no pattern we can see with that.
Got to
But
do it more. Got to do it more. Find
yeah,
patterns. There are going to be multiple patterns too, which is the beauty of it. You know what I mean? Find a pattern, go all in on it, and always continue. Go in on patterns where that it's like a 60-40, right? Because you know you're going to get consistent good views here, but then every third or fourth one mix in a new idea, a new, right, a new theme.
okay. Yeah, that's wonderful advice for not only us as content creators, but for any other university student that's looking to be a content creator as well. Um, TikTok is a up and coming platform at the moment, so it's best to utilize the tips that Brendan's providing as soon as you can. And sorry, did you have something to say, Brendan?
I'd argue TikTok's also it might be around the down, on the other side of the peak. But yeah, yeah, I mean, I'm just, I totally agree with you.
Of course. I mean, with the fact that there's the introduction of a lot of bans on TikTok for when it comes to certain like professional devices, it definitely makes things harder for content creators. So that's something that we can empathize with as well. But just to bring things full circle, and this is going to be our last question to you, it's going to relate to your experience in dental school at large. So we know that dental school is really expensive, apart from, of course, the New York University where tuition is free. We just like to ask you. Oh, yes.
Medical school at NYU is free. The dental school of NYU is the most expensive dental school in the United States.
Wow. Okay. I personally didn't know that. So that's crazy, and that makes the question all the more relevant. How exactly did you go about funding your schooling or just your career in general?
That's a great question. So it's tough. It's tough because, and I try it. Here's the thing. I always get back and I try to look at, like, I sell things on eBay to help me make my rents right now. I'm literally doing. I'm selling my old dental equipment, but it's tough. And I noticed this in dental school. We had 44 students in our dental school class, very small. A handful of us had, like, our parents were able to support us with tuition. And I also noticed after that was revealed early on, because everyone was transparent early on, and then we found out that, people are kind of getting shunned for certain things. And one of them was, oh, those are the rich kids, right? And one of them had a bad attitude. I'm not going to lie. One of them did. She didn't have to talk like that to other people. But then that kind of gave a rep for a few people. And I'm like, no, 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 no. We're all in this together. We're studying together. We're all the same goal here. We're treating patients. So I was very fortunate. My family was able to afford and pay for my tuition through college and dental school. They did, and I'm not gonna lie, that I had to pay for all like room and board through dental school, all my groceries, expenses, everything, gas, oil, water, all the bills. But they were able to afford my tuition. Now, is that like it? Is it? It's a weight lifted off my shoulder, but do I not have to pay that back? I absolutely have to pay that back. That's part of my family's agreement, and it's expected that I will, and I have all intention of paying that back and more, as well as paying it forward for my kids. Because I know that's how my family was. It wasn't like I'm assuming loans. We were going to go in that direction. How to afford to pay loans, right? And I'm obviously not the guy to 100% talk about that, right? Especially with the rising interest rates and such. I think the biggest thing is when I talk about in healthcare, insurance is taking over everything. I mean, it's about what insurance covers and what's not, and they're not covering as much as they should. They really aren't. If you look at in like the 90s when insurances started to give the, at least in dentistry, the where they give you like a certain amount of money to spend per year for any treatment whatsoever. In the 90s, it was like $1,500. Now it's like $2,500. But the cost of everything has gone up so much more. Why isn't insurance companies increasing? Look at interest rates. Why are insurance? I don't know why. I think they claim that they're non for profits. They're completely for profit. Something's going on there, and it's preventing patients from getting care that they need. It's making look the doctors look like the bad guys in some circumstances. Why are you so expensive? This and that. So that's one thing. Dentists and doctors are not getting reimbursed the way they used to. Two, they're also in so much more debt than they used to be. So the gap has become so much further. And then a third thing is doctors and dentists aren't starting to work as early as they used to. Because now think about it, in medical school, they're going into residency, and then they're going into a fellowship, and then they're going to a second fellowship. So you're not starting to work until later on too. It's a different lay of the land and age. I think finances are a very important thing. One, I mean, happiness and passion is always number one, right? You need to follow your passion and dreams and everything. But I think it's very important to be aware of, if you want to start a family, you want to own a house in the future, maybe you want to own a practice in the future, the finances need to be considered immensely.
I think that those are some very important issues that need to be brought up and they need to be addressed at some point because, like you mentioned, we talk about this a lot. Just applying for surgery residencies or even going into surgery, medical school in Canada is minimum 5 to 7 years of dedicated residency time. And not just money, just like you mentioned, starting a family or starting a business on the side. Working 80 hours for 5 to 7 strict years is dedication that is required, and a lot of money as well. So I think these are all the factors that stray you away from competitive residencies like this. Even though we need more doctors, we need more surgeons. But regardless, Brendan, thank you so much for taking the time out. We've talked about everything from dental school to medical school to entrepreneurship, and we want to thank you for making time. Do you have anything else for the followers?
Oh, thank you guys. No, no, thank you guys. Thank both, all three of you. Really, I got to get you guys on TikTok, on Instagram. No, I have you guys on Instagram. I want to find those posts. I want to take a look at your content. Let's talk. Let's collab some stuff. Let's talk about like strategy. I really want to open the conversation to that. Any questions you have, any questions we have, I want to be able to throw them your way too, and get all your guys' insight too, because you have an extreme amount of experience as well.